In this video, you're going to see 3 simple chair exercises that help take pressure off an L4-5 disc bulge and relieve leg pain. You won't need to get on and off the floor. Everything can be done right from a chair. These moves are gentle, safe, and can start giving you relief quickly while keeping your spine protected. I've used these exact exercises with hundreds of people dealing with lumbar disc bulges. They work because they keep the spine moving and reduce nerve irritation without adding pressure to the lower back or discs. And later on in the video, I'll show you one bonus exercise that targets the sciatic nerve that relieves leg pain fast without even leaving your chair. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. Before we jump into the first exercise, here's why I designed the sequence around a chair. If you're dealing with a lumbar disc bulge or sciatic leg pain, just getting down to the floor can feel impossible. A lot of therapists, doctors, and popular rehab programs assume you can. That's a problem. The 3 chair exercises I'm about to show you eliminate the need to get to the floor and make real relief accessible from your chair. They're designed to relieve pressure and nerve pain so you can finally start healing without flaring things up. And I'm not showing you just random exercises. These are the exact movements I use with patients who need safe, disc-friendly relief that actually works. Do them daily in this order, and you'll start to feel the difference in more mobility, less nerve pain, and greater confidence in how you move. Let's start with number 1. It's all about gently activating your lumbar spine from the safest possible position. Number 1, seated pelvic tilts. We're starting with seated pelvic tilts because this is one of the safest ways to begin reconnecting with your lower spine, especially if standing or bending movements trigger your pain. Sit upright in a sturdy chair with both feet flat on the ground, about hip width apart. Your knees should be roughly 90 degrees. Now, without leaning forward or backward, gently tilt your pelvis forward to create a small arch in your lower back. Then slowly reverse it by tucking your pelvis under and flattening your lower back slightly. Think of it like rocking your hips forward and back. The movement is subtle but powerful. Start with 10 slow, controlled reps and then gradually work your way up to 30 reps per day. Focus on breathing steadily and keeping your upper body relaxed. The seated pelvic tilt reintroduces safe mobility to the lumbar spine, and it begins to activate the deep stabilizers, all without compression or strain. It also gently mobilizes the lower lumbar discs that helps draw healing nutrients and fluid back into the disc space. You might also notice that your leg pain starts to ease or even subside during this movement. If you're dealing with sciatica on one side, try gently tilting forward at a slight diagonal angle towards your knee. Do this on both sides and see if one direction gives you more relief. This modification to the seated tilt can help you find the position that decompresses that irritated nerve. If you feel less tension or reduced symptoms, that's a very good sign. It means the disc and nerve are responding well to the movement. Now that we've gently reactivated your spine and mobilized the lower discs, let's take that relief a step further. Exercise number 2 helps restore the natural lumbar curve, relieves pressure on the disc itself, and continues shifting irritation away from the nerves that cause leg pain. Number 2, seated lumbar extension. This next exercise builds on the mobility we just introduced and adds controlled extension to the lower spine. Seated lumbar extension is especially helpful for relieving pressure on a bulging lumbar disc and encourages the disc material to shift away from that nearby nerve root. Start by sitting tall near the edge of a sturdy chair. Place both hands behind your back for support with your fingers pointing down and your elbows slightly bent. Now gently lean your upper body backward using your hands to guide the motion and support your spine. Keep your feet flat and avoid lifting your chin or straining your neck. You're aiming for a small arch in your lower back, not a big lean. Hold the end range for 2 to 3 seconds, then return to upright. Then repeat this movement 10 times, moving slowly and staying within a pain-free range. As you notice more and more relief, work your way up to 30 reps per day. This gentle extension encourages the disc to shift forward towards the center, which can reduce nerve irritation and start to centralize the symptoms that may be running down your leg. It also restores healthy curvature to the lumbar spine, especially if you've spent a lot of time sitting in a rounded posture. If you notice leg symptoms reducing, shifting upward, or becoming less intense during the exercise, that's a great sign. It means the pressure on the nerve is calming down. Now that we've restored both motion and extension, let's move into a position that creates light traction and space through the lower spine. Exercise number 3 is a nice, safe decompression traction move, and all you need is a chair. Number 3, seated decompression or traction move. This next exercise uses a simple traction technique to reduce pressure through the lower spine. While it's not true decompression like you would get from a machine or an inversion table, it can still create enough unloading of the disc to get real noticeable relief. Start by sitting in a chair with armrest. Place your hands firmly on the armrest and gently press down to lift your body just slightly so your hips become lighter in the seat. You're not trying to hover completely, just lighten the load throughout the lower spine and let the body gently lengthen upwards. Hold this position for 5 to 10 seconds, then slowly release. Rest for a few breaths and then repeat 3 to 5 times. As you lift, you may feel subtle stretching or lightness through the lower back. That's your spine decompressing under its own weight, which can help reduce disc pressure and help ease the tension pulling on those nerves. If your chair doesn't have armrests, you can still do this. Place a sturdy chair on each side of you, close enough so that you can comfortably rest your hands just outside your hips. Then stack yoga blocks or firm books on the seats on the side chairs to raise the surface. This brings the height to a comfortable level so you can press down and gently lift your hips, creating the same unloading effect through your spine. Make sure the blocks are secure and evenly stacked, and keep your movement slow and controlled as you lift. Whichever version you use, move slowly and stay relaxed through your shoulders and neck. If you feel relief in your back or a decrease in leg symptoms, that tells you the traction is working. Now that we worked on reducing the disc and nerve compression, let's finish with one bonus exercise that directly targets the sciatic nerve, which is responsible for that debilitating leg pain. You don't want to miss this one. Number 4, seated sciatic nerve glide. If you're feeling pain, tingling, or numbness down your leg, it's likely coming from irritation at one of the lower lumbar nerve roots, usually L4-L5 or S1. These nerve roots exit the spine and come down to feed the sciatic nerve, which runs down the back of your leg. So even though your disc bulge is in your lower back, the symptoms often show up further down the chain. That's why this nerve glide is so powerful. What we're going to do is gently mobilize or floss the sciatic nerve along the nerve roots that feed into it. This helps reduce sensitivity, improve movement throughout the nerve path, and give you relief where you actually feel the pain, in the leg. Start seated tall in a chair with both feet flat on the ground. Straighten the leg on the painful side, resting the heel on the floor, and pull your toes gently towards you. From here, slowly begin to straighten your knee as you lift your leg slightly, just until you feel a light tension or stretch behind the thigh. At the same time, look down, tucking your chin slightly. Then slowly lower your leg back and return your head to normal. Repeat this 10 smooth reps, moving with control and staying below your pain threshold. You're not trying to stretch hard. This is a gentle glide, not a deep stretch. What this does is help the nerve move more freely through the surrounding tissue, which can reduce irritation, improve circulation around the nerve, and ease that painful pulling sensation down the leg. The nerve glide can be a game changer if you're dealing with radiating leg symptoms from a lumbar disc bulge. And the best part is, it works with all the other exercises by addressing the nerve component directly. Now you've got 4 seated exercises designed specifically for lumbar disc bulge and sciatic pain. These are safe, effective, and accessible, especially if getting on the floor isn't just an option for you right now. You may begin to feel less tension in your lower back, more mobility in your hips and spine, and a real reduction in the sharp pain that's been going down the leg. Give them a try and tell me which one gives you the most relief. Is it the seated lumbar extension or the sciatic nerve glide? Drop a comment below and let me know. If you got value from this video, like and share it with someone who needs gentle, proven relief from back or nerve pain. And remember to subscribe if you want more simple exercises and expert tips to help you move better, feel better, and stay pain-free. And if you keep going, here's the perfect video to watch next. Sitting with a lumbar disc bulge, these 5 mistakes make it worse every day. Watch this video next so you don't undo all the progress we just did with the exercises in this video.